in honor of your dad last week. And for those that are joining in, appreciate you being here. And if you're joining here for the first time, we do a weekly, we've been doing these weekly webinars since October of last year. And we also do a trivia from last week's topic. So if you weren't on last week's topic, you should have been there. We interviewed Dr. Jose Delgado, who is the CEO of Epi Compliance, and we picked his brain on his experience and his direction he wants to go with Epi Compliance and streamlining those processes. And anyways, we're going to share a screen and do a trivia question based off that presentation. And by the way, if you did miss that presentation, it is up on our YouTube channel. I will be sure to post that in chat here at the end of this webinar so that you guys can subscribe. And like I said, if you haven't seen any of the webinars, you can check them out. So I'm gonna go ahead and share screen. Jose, let me know if you can see. Might take a second.
Not yet.
How about now?
There we go. Now we got it.
Awesome. Let's do it. Man, I can hear myself clap now through these through this microphone. But anyways, trivia question for today is: during last week's webinar, Dr. Delgado shared his expertise on HIPAA compliance and cybersecurity in the healthcare industry. What is one of the key contributions Dr. Delgado has made to the field of healthcare compliance? And the choices are A, developing a revolutionary electronic health record system, B, creating the Certified HIPAA Security Officer certification program, C, implementing a statewide telehealth initiative, and D, founding a global healthcare charity. Or statewide, I'm sorry.
Yeah.
I said global. Feel free to put your answers in chat. If you weren't on last week's webinar, listen, feel free to just take an educated guess. No harm, no foul. We'll give it another 20 seconds. Jennifer says B and D. All right, it's fair. Come on, don't be shy. I see Anna Engie's in here. All right, Jennifer's the only one, huh? All right, fair enough. So the answer is actually B, creating the Certified HIPAA Security Officer certification program. Now, for those of
And
you that don't,
Jennifer, if it was up to him, he would do D, but I won't let him. We don't have that Clinton generational wealth to be able to do that kind of thing. So
not yet, at least, not yet.
not yet, not
But
yet.
for those of you that are maybe unfamiliar, Dr. Delgado or did not attend last week's webinar, Dr. Delgado started Epi Conferences, which is an in-person event that we've hosted here in Jacksonville, Florida, Orlando, couple different areas here in the Florida region. But that conference is based on innovation, and one of the certification programs that he created and we conducted at these in-person events is a Certified HIPAA Security Officer training, which covers and Jose, feel free to chime in, all the technical, physical, administrative safeguards of HIPAA. And it really gives you, if you're a practice manager, a compliance officer, even a student that's looking to get into business, really a deeper dive into what HIPAA entails and what it takes to maintain a compliant practice in business. And this is a course that we're going to be offering online soon. So please stay tuned. We are going to have a sort of a pre-registration. I know in previous webinars we've mentioned a date. Unfortunately, I don't have a specific a specific time frame yet, but stay tuned. But I think in the next coming weeks we'll have some sort of pre-registration form for those that are interested in learning more. We'll provide those details for you. But Jose, did you want to mention anything other than
I would say that we will probably be doing it towards the end of Q3, beginning of Q4 of this year. just
Yes,
because of the way that everything's kind of rolling. But yeah, stay tuned. If you've got any questions about it, just let us know and we'll be more than happy to keep you in mind for everything, keep you updated.
absolutely. So I appreciate you guys participating in that. And let's go ahead and dive into today's subject. So give me just a second. I'm going to open up the presentation for you guys. Jose, you can still see.
Yep.
All right, let's do it. So, welcome everyone, and thank you for joining us for today's session. And the topic of discussion today is going to be HIPAA security, evaluating the recent ransomware attack on Ascension Health. I'm Ray Walters, and I will be your host. And thrilled to have my co-host here, Mr. Jose Jr., who has been on quite a few webinars with me. Um,
Yep.
is going to be
Definitely.
joining us once more. And just to give a little bit of backstory of Jose, he's got it almost, or what is it, close to 2 decades of experience at this point, or are we
No,
in
it'd
that
be
mark?
it'd be 2 decades now.
2 decades. Holy.
Yeah.
So Jose's got 2 decades worth of experience in healthcare consulting, cybersecurity. He also currently owns a mental telehealth clinic and is also an instructor at our in-person conference event for that HIPAA security officer training.
Every
Jose.
single piece of your business right now, if you're anything like mine, which granted, we are a very high tech office because we do a lot of we do as much as possible through telehealth. Mm, We need to know what to do when something goes down. We have to know. So
Just like the internet. Anyways.
yeah, yeah. I mean, so we've got to know what to do. I would say that this is definitely something to where you've got to practice your backup procedures on a regular basis, especially if you're in the southeast right now. We're coming into hurricane season. So you know what
Absolutely.
that means. People are going to lose power, people are going to lose internet. You're going to need continuity of care, especially depending on the type of industry that you're in. Do you remember how to build things through paper? Does your billing team know what a CMS 1500 form looks like? Does your office staff know what to do with a paper referral? Do your patients know what to do with a paper script for a pharmacy? Or are you able to call this stuff in to the pharmacy directly? Can your pharmacy handle this stuff? So these are all questions and things that it's going to take a little bit of time. But if you take a little bit of time on the front end to prep, you won't be in as bad of a situation on the back end. Um, Here in Florida, we experienced it was a rather interesting situation because like Ray was saying, he knew he had somebody at St. Vincent's that was in the middle of the mess, but I had people in other hospital systems that were reaching out to me immediately upon hearing that St. Vincent's was not accepting patients even for the emergency room. And when prodded a
That's just
little bit,
nuts. But that's
yeah, when prodded a little, I mean, the emergency room piece is wild to me in general, just because you mean to tell me that nobody knew how to operate without an EHR that badly, even on an emergency setting? Like, that means there's a major issue there that they need to work on their backup procedures because power goes out. What are you gonna do? Internet goes out, what are you going to do? I mean, a lot of people in Northeast Florida have Comcast. If you have Comcast, you know what the problem is with their service. Everything. Because they've got garbage internet. And I'll take that to and they can take that to the bank. So I
funny you say
mean,
that.
gosh, dude,
It's true
Comcast is
though. It's true. Although we switched from Comcast to
a
T-Mobile and it
company.
just went out on me, so
I mean,
now I got a bone to pick.
yeah, I mean, you'd be, yeah, yeah. Thank you for proving my point.
Yeah.
But yeah, so I mean, what did your inside man have to say about it? What was it? What's been his experience?
Well, you might have mentioned it earlier, but there was three systems, hospital systems here in Jacksonville alone that were affected by this, and he basically reiterated that there was the pharmacy aspect that was affected quite a bit.
Yep.
Um, their application, uh, I guess it was down. It wouldn't allow them to send out any or fill any prescriptions or anything, and that took a huge effect. And then obviously when it come down to informing patients of the issue, I guess they had
Mhm.
a their internal, and again, my friend is not in the IT sector. Okay. So we can't
It's
he's strictly in the finance. So but he said that they had I guess a time trying to figure out how they're gonna notify all their patients and how to get those updates out to let them know, there's an issue.
notify them of what? That there was a breach or that there were
Yeah.
services being disrupted?
Both. Both.
Okay.
But obviously the initial was the services being you know, being down. So, which
Yeah.
I've seen it, and again, I talked to him last Thursday. He had
Yep.
mentioned that they sent out, I guess they're conducting phone calls, they were sending out emails to patients. And then I also see on their website that they have some sort of, I'm going to put it over here in chat, Jose. I don't know if you've seen it, but they're posting updates on their, I guess they have a resources page on their website. And this was one of the more recent ones. It's June 7th uh,
Last
notification.
week.
But he said they've been really focusing on trying to get the word out to
Yeah.
everyone. But the main
So I
thing
mean,
he mentioned to me, which was a huge issue, obviously here in Jacksonville, which I can only assume. I mean, there's 140 hospitals affected, right?
yeah,
It's
19 states.
yeah, across 19 states. I mean, their pharmaceutical app going down. That's huge. I mean, that's just one of their applications. I think they had actually might have listed here in this presentation. They had their EHR was down as well, or I think
Yeah.
the my chart is what it's called, patient portal,
Yeah, they had a full system just complete
phone
detonation.
phone systems, and obviously that's created quite a few challenges to navigate.
Yeah.
And
So I mean, it goes back to redundancies, right? Like, one thing in common between change and this is that the pharmacy piece is taking a lot longer to bring back online than everything else.
yep,
Now, that's not to say that necessarily they're because of prioritization issues, but it could lead to that this is more of they're coming in through the pharmacy piece. Now that is completely my tinfoil hat, you know,
is that what you
Occam's
think?
razor. The simplest answer is the most correct answer.
Sure.
But if both of them are heavy, both change and ascension, both are having heavy problems restoring their pharmacy issues. Either their pharmacy pieces are too complex and or they're having problems with that specifically, and that may have been how they got in.
One thing
Um,
that I don't know, and maybe this, I know you said you had a couple contacts, is, where do you think the entry point was? Was it through?
so for this one's interesting. They haven't said they haven't been dragged to
Exactly. I haven't.
Congress yet.
Yeah, yeah.
Yeah, they haven't been dragged to Congress yet, and I don't know if they will be dragged to federal Congress. I am pretty sure that DeSantis will probably bring them to task and want them in front of the Florida House or Florida Senate.
Sure.
Um, but I don't know for sure where it could be. I mean, the problem too is that you have these large organizations that have hundreds of vendors, and their
Yep.
vendors may not be nearly as, how can I put this? Have as serious of a compliance atmosphere or environment as you would expect. So that goes back to some of the other concerns that we've had when talking about change as well, where I can do everything I can in my office to provide my team the education and the tools to be HIPAA compliant.
Yep.
But that doesn't mean that my IT companies are as rigorous in that as I am. That doesn't mean that my 1099 providers are as compliant. That doesn't mean that my if I've got a virtual assistant, because that's a very popular thing right now because where everyone's looking to reduce their overhead. What's my virtual assistant looking like? And I've seen some contracts with some of those virtual assisting companies where you're hiring the virtual assisting company, they're picking up somebody else, but the virtual assisting company creates some kind of crazy bubble
Third
layer.
third party of a third party.
Yeah, so even though it's amazing because I saw one contract where even though the contract was with the virtual assisting company, the individual that they would bring in to work your account, they
Yeah.
would somehow able to completely do a pass through on responsibility and liability. And I'm like,
How,
that's
how, how does that work
it's
for
bullshit.
business associate agreements? You got to have one with just the main
Well,
third
so the
party,
problem
or
is that if the
just
1099 company, so like let's use a virtual assistant company, right?
sure.
So if they're a vendor of mine, right, and they hire 1099ers to be the actual virtual assistants, that's a third layer that technically, if we were to really be sticklers about this, the most protected person would be that individual because they don't have any assets to sue them for when they screw up anyways, right? Because for
Yeah,
lack of
no,
a
it makes
better
sense.
for lack of subtlety, the hiring firm is basically the pimp.
Yes, it's true. It's true.
What's the pimp gonna do? The pimp is the one that's got the one that's got all the liability, all the logistics, but somehow they're trying to pass it through in their contracts and everything else. And
But from a
there was one company that one of our clients that I said flat out, do not work with this firm because they're trying to pass all of the liability off onto the virtual assistants out in the Philippines.
mhm. So imagine that
And
situation, right?
I mean,
And
if
and you have a
it would be
business
easy,
associate agreement in place with the pimp.
yeah.
But
But then
the
but I'm the covered entity. So do
right.
I have to have now of do I as the covered entity have to have a BAA with the subcontractor of the vendor? No,
I would
because the
imagine
way that
no,
the
but
rules work, now the vendors are on the hook just as much as we are as covered entities.
hmm,
But at the end of the day, what are you going to do about someone in the Philippines?
yeah,
What are you going to
that's
do? How are you going to punish them? They're already in the bloody Philippines. You know what I mean? Like,
not
so
much you can do.
no, not
Not
much at
much you can
all.
do.
So, I mean, I would not be surprised if in this case it was either, again, just like change where it was old credentials or that it was through one of the vendors.
I was gonna say if you think it could have happened internally, you just
Well, it's always
it's
internal.
right.
These level of situations are always it may be an external company, but there's always an internal vector. Now, whether it was negligent or whether it was on purpose, that's a whole nother bag of tricks. Like, do I think that there was a mad CNA or a mad receptionist that gave a hacker all of the information? Not normally. I mean, is it
You see that happen
possible?
on a lower scale.
Sure. Huh?
I said I've seen that happen on a lower scale.
Yeah, all right. So yeah, on a
Easy.
lower scale, but you have a different problem there, right? On a smaller scale, what you would do is that you wouldn't give it to hackers, you would just straight up embezzle the cash from the insurance companies.
Yeah.
You know what I mean? Like that I've seen, and sadly, that's far too frequent when you have billing completely in-house.
I'm also
Um,
saying on a smaller scale, you see practices that you know you, you deal with those disgruntled employees or past employees, and you forget to relinquish their credentials. In other words, you don't deactivate them from any of your systems. I've seen that happen on a
yes,
smaller scale.
yes. And but you know what else I've seen? When that happens, that person is caught so
Oh,
fast.
absolutely.
And then they throw the freaking book at them. So yeah, as the covered entity, I might get in trouble because that was an employee of mine. But the second they find out, hey, that was an ex-employee, and this is why I fired them was because they did something stupid, or they did something stupid in retaliation. Now all of a sudden, I have a little bit more of a window of saying, hey, it's not that I did anything necessarily wrong as the covered entity. I just had a bad actor, I had a bad apple in my bunch.
Right.
right? So
It's still a reportable offense though,
no,
right?
no, no. It's
Especially
absolutely
now.
reportable, but it's the reason why I say it's so stupid is because this stuff is taken very seriously right now.
Absolutely.
I
Yeah.
mean, so if you're a US citizen and you release this information here, you're getting caught. And then you're going to see jail time and fines. And because there's no way you didn't know not to do that.
No,
Like
absolutely.
it's something to where it's I mean, people say it's doxing, but I mean, you're basically if you wanted to be difficult about it, every single patient that you release that information of could be a charge of stealing the identity. And if anything happens, you're a party to. You could potentially be a party to the felonies that are involved there. The wire fraud involved there. And you don't want that nonsense. That's not county jail. That's club
It's federal.
fed.
Oh yeah.
That's serious, and not like club fed like Bernie Madoff. I'm talking about like the real club fed. So I mean, the juice just isn't worth the squeeze on that kind of thing. And here in the
I agree
US,
with
I
you.
find that the people that do that kind of thing, they were already kind of off, so they were not going to make a rational decision. The people that are doing this kind of
Too
thing are
hot.
not in the US. I mean, they're
Yeah.
not. I mean, the
Yeah,
FBI
yeah.
has come out and said it. Their cyber terrorism unit has come out and said it. HHS is aware of it. Congress is aware of it. That there is no legal. And I've even had a conversation with several attorneys and several people trying to push legislation through that they're like, hey, we want to do this proposal. And I'm like, the problem is you got to have carrot and stick for laws, right?
Yep.
There's no stick if you can't catch the guy, or even if you know the guy, but they're in to throw a country out there, Russia or in China or in some place where they do not have an extradition treaty with the United States. You can't get them.
They haven't disclosed the group that got Ascension
No,
yet,
they
have they?
haven't. They haven't. No, Ascension's been very quiet about this. It actually took them about a week to report this to the news,
It happened
and
what,
I it
May, earlier in May, or no, late
so
May.
this was the breach happened on May 8th, and I want to
May.
say I didn't see a press release about it until the 13th,
Yeah.
which is wild to me.
And I was with my friend 2 weeks. Well, when he first broke the news, I was with him about 2 weeks ago is when he had mentioned it to me. And yeah, at that time,
Yeah,
I didn't see anything on it really.
well, when the care coordinator friend of mine that told me about it right away, I was like, whoa, how are you finding out about this? And she's like, well, I'm a care coordinator. So they're letting all of us know right now, right off the gate, like, don't even bother trying. It's not coming here. So they were scrambling to figure out other plans for those that were near the Ascension area. But I mean, it's an interesting situation. I mean, if you're an office manager, tighten up your HR. And what I mean by tighten up your HR, if you voluntarily or involuntarily separate an employee before they walk out that door, you better close out all access to any system they got. You know what I mean? So make sure that again, follow up with your vendors. Make sure that they're following all the things that they got to follow. If they're a credit card processing company, they better be following PCI compliance regulations, which again is financial HIPAA, but whatever. Anyways, not to
Hmm.
get, I mean, we got to figure out what's going to be the situation. Now, the financial implications on this one are going to be interesting because they're not on the stock exchange. They're
Saw that.
technically a nonprofit. So they're a little bit more opaque when speaking about their finances.
I'm very interested to see. I was trying to get a little more information on the class action lawsuits that were filed. I couldn't really find
For which one? For change or for this?
for Ascension.
Ascensions doesn't have any public yet, but they will.
Yeah, it's too early. We're gonna have to host another one on this sometime
Yeah,
down the
so
road once.
this one, Give it another month and you'll start seeing
Right.
them get compiled, because the thing with class action is that you need a quantity, right? So you're gonna have some of the markets that Ascension is in, they have pharmacies. So if
Right.
I'm so let's take me as a mental health clinic. I prescribe class twos to my patients. There are serious complications to my patient's health if they go without their class two meds. And if you can't even receive my referrals, but you didn't know that you couldn't receive my referrals, that's a problem.
Oh yeah.
If you can't go, and there were some situations where if you're let's say you're a dialysis center, you're a rheumatologist that you buy and bill, unless I'm getting my biologics straight from the straight from the pharmacy company. If I'm getting them from pharmacy, you got a problem. There were a lot of problems and due to this. Wait time is going to be through the roof, because a lot of the staff, like I was saying while you were out, they
Mhm.
don't know what these paper forms look like. They don't know what to do when technology goes down.
Isn't that
Are you
crazy?
kidding me? There was a joke in my office last week that one of my employees' siblings couldn't even go to the bathroom without the tablet.
Stop.
I'm just calling it like I see it, right? Like when
That's
you've
wild.
been
That's
in,
I was
I
saying
mean,
for you, obviously, you've 20 years of experience. I mean, it's just nuts the change now. It's so reliant upon now technology, and there's
Ray, I'll
no
take it even one step further. Remember, 20 years ago, ready, everybody? I'm gonna age myself again. Everybody was on wireless, and you were fast if you had a DSL connection.
yeah
If you had an EHR at that point, you had a server on site. Here's the irony. You ready for the irony, Ray?
yeah
Why did everybody drop the servers in office? Because of the cost. Updating, maintaining a server,
sure
there was cost there, there was some liability there, because if someone actually came in, they could actually go physically to the server. Well, now everything is serverless, everything's on the cloud. All you
everybody's
need is a password and internet access.
you got
I
two-factor
hate this.
authentication now.
Well, so this is the problem, right? And this is I love arguing with IT guys about this. When there's the seesaw of I have access to my information and then the information is secure. If you want to be perfectly secure, you will never access the information. It'll never
Yeah,
be accessed.
fair enough.
But if I'm going to use this information every bloody day, I want ease of access. I don't want to do multi-factor authentication every 10 minutes when I log into my EHR throughout the day. I work 9 hours a day in the office.
Agree.
Can you imagine that nonsense? I take one phone call, and if I'm not on the EHR piddling around and moving the chart around, it's
I'd
going to
be
log me out. Now I got to do a multi-factor again.
I'd be pulling my
I went
hair
to
out.
go pee. I went to go pee. Multi-factor again. You know what I mean?
Yeah.
It
No.
just becomes so it's you had this seesaw, and you got to figure out which systems we need that for, which ones we don't.
Absolutely.
Do I work virtually from home? Then what's my system set up like at home? So I mean, it's where do we go? What do we do? All of that fun stuff. I think the general opinion right now is, if you work for a large firm or large organization, you want the federal government to do more. If you're in a smaller organization, the federal government is not going to do anything more productively at all. So they might as well stay the hell out of the way. Because every time they touch something, it ends up costing us more money at the smaller end. So,
What do
I
you think these
mean,
larger health systems like Ascension can do?
so
As
the
far as
problem
their
is
IT,
that,
as far as their IT is concerned,
well, so let's Change's problem was a lack of multi-factor authentication.
right. And they had it.
At the very least, your systems should be forcing multi-factor authentication, in my opinion, whenever you're using a different device than normal.
Agree. 100%.
So, for example, I get a new work computer. It might be a pain in the butt, but all right, new multi-factor authentication.
You do it once and it's fine. Yeah, as long as it
Agreed. It's
rains.
not a big deal, but I mean, if
Right.
I'm a billing person, I'm logging into my EHR, my billing, my schedule, my credit card processing. That could be 4, 5, 8 different systems. But at the end of the day, I feel that that would be at the very least minimum that you need. There should be no reason why anything that has PHI or financial information for anything, even if it has no patient information, but it has business information, there's no reason why you shouldn't have multi-factor authentication on it, at least at the device level.
That
There should
makes
be no reason why somebody uses old logins, old passwords. I mean, right, this is some Return of the Jedi crap. Well, it's an old password, but we're going to let them right on through.
yeah.
Like, what are we doing? Why is this happening? Why?
It's
And
it's
again, I go back, it's the human
it's
element.
common sense stuff, but you're right.
I
It's the
mean, it's the
human
human
element.
element, right? Like,
Human element.
you can't say that Change Healthcare and Ascension don't have the funds and are not diverting the funds to cybersecurity. The problem is that they're diverting it to the higher end levels and not where the problem is, which is the
At
lowest
the
common denominator.
yeah, at the employee level.
Yeah. So I mean, and I mean, there's also a problem with accountability in these larger organizations because what one location does is not the same thing as another location. Because management
Yeah,
is the same,
absolutely.
culture is not the same. They may be the same company, but come on. I mean, we're in Northeast Florida.
Listen,
Let's call a spade, right?
I work for public
Shands in
supermarkets.
Gainesville is very, very different than Shands in downtown Jacksonville.
Yeah, agree. Agree.
I'm just saying. You can
From
call it
a
whatever reason
whole
you want, but Shands, the organization, is even aware of it to where they don't put as much money into Shands downtown.
uh, I agree. And that's based off of what would you say? Patient population?
I
Mostly?
would, so let's be generous. It's not based on patient population, it's based on payer mix.
Fair enough.
Because when you're a hospital system, you're getting more generous contracts from Medicaid because they're the only people that have to take Medicaid when you're a community hospital. But they're taking all the insurance plans.
Yeah. Um,
Unless you're like a Mayo, but I mean, that's a completely different bag of tricks. This is a 19 state organization. They're on every insurance panel that exists, probably. Between the children's hospitals, the cancer centers, the just the variety of locations. So, I mean, you got to look at it like that. Like, what are we going if I'm a larger organization, I need to pump more money into the day-to-day operations and that HR people know, all right, this person's voluntarily separated and involuntarily separated. Before they walk out that door, all their stuff is done. One of the other things that I see that's not happening nearly as much as should be, and I think it's more because the technical capabilities are not there, even though it's a HIPAA security standard, is that EHRs do not have necessarily the ability to segregate information and patient access from location to location.
so you're saying things are managed more
So
centrally and
no, no, no. So what I mean is this, right? So from all of the EHRs that I have seen,
mhm.
what they do is they segregate your access to data and the capabilities on the system based on your license or based on your job title.
Oh, okay, gotcha.
But they do not segregate it based on your location.
Hmm.
So if I'm part of Ascension, like I could be looking at information from Ohio, from Idaho. Now, granted, they probably have spent a little bit more money on their EHR to prevent that type of thing, I would hope, but most of the time they don't look at that kind of thing
Actually,
because
don't
it's
know
not.
what I don't know what EHR Ascension Health uses. I'm kind of curious.
From the
I'm
looks
sure
of
my
it, they
friend
have
could
their own.
answer,
They
but I
call it
never
My
asked.
Chart.
Oh, my chart. That's right. My chart 4.
I don't know much about it because I haven't played with that one much, but most of these EHRs are the same, right? So I would say honestly, either way, if I'm part of that cybersecurity team, that's one of the major things I would be doing that because I would be able to then at least segregate and isolate more of that information, right? Like
Right.
I would be able to say, okay, they got in using a Florida employee login because they got access to the Florida patients.
Yeah, that's a question for my friend.
Because you should be able to
I'm
audit
curious.
because you should be able to audit trail every single employee on all systems that have PHI. And if you're a bloody
Absolutely.
EHR on our current ecosystem, there's no reason why you should not have a user audit trail. It is very clear. It has been clear since meaningful use stage 1 and EHR certification stage 1. It's very, very clear. You have to have user audit trails.
Would you say these larger healthcare organizations conduct yearly risk assessments and
They do it internally.
internally?
Yep. They have to have something that
What about penetration tests and
I'm sorry. One more time.
like penetration tests and on their IT system? Do you think they
That
do
one I
enough of
wouldn't be able to
that?
tell you if they do it honestly. A lot of companies, what they'll do is, especially larger organizations like this, they have their own compliance department. They have their own IT department.
Right.
They'll handle it all internally. Very rarely do they do things externally unless they're mandated or legally obligated to do so. Um, is this something that they should do? Yeah. Is it something that they should probably hop around to different organizations and do? Absolutely. Do they? Mostly not. Not that I'm aware of, anyways.
I was gonna say that it seems like the way things are going that other organizations got to be on their toes, or they're next.
It's one of those things where as this happens, it makes me want to, as an entrepreneur, as someone who's actively, aggressively growing our practice, I don't want to grow our practice outside of the state. It doesn't make it
Yeah,
worth it to me.
yeah,
Because then it puts a
it's
giant
tough.
red flag on me for whatever reason, whatever it is that these hackers are using as the metric to decide we're going at these guys. The only thing in common right now is that they tend to be larger organizations.
You're
I
you're
don't know if I'm, you know what I mean? Like,
no,
is
you
it
got a good
worth it
point,
to me?
and that's
Is
sort
it
of
worth it to me?
right, and that's kind of what we're going to be talking about next week. Is it
Yeah.
is
Now, it's very, very different. You can operate a multi-million dollar, like multi-millions of dollar practice with one or two locations depending on the specialty with
sure.
not that many providers actually. You can do it. It's just a matter of what kind of specialty are you? Where's the money in your specialty? Because every specialty is growing. If for no other reason than there are more patients for every single specialty as our overall population ages, which is a whole nother problem
Oh
down the
yeah,
road. But um, so I mean, as far as a practice is concerned, your two main concerns are my lowest common denominator and my vendors. In regards to this, in regards to the other stuff, I mean, we can go into that some other time.
no, absolutely, and I mean, for those that are maybe in Jose's shoes, have a smaller, rapidly growing practice, and you know, if this is opening an eye to you, there's systems out there that help put these measures in place, like Epi compliance.
Yeah, I mean, so it's nice to have a baseline, but again, what's the point if you don't use it?
True.
You can't, I mean, it's like those people that have Ferraris that don't drive them. What's the point?
Good point.
You have a boat. You haven't put it in the water in 2 years. Why have a boat?
I'd say for
If
these,
you're going to have a compliance program, use it.
yes, yes, especially for those that are trying to do these things in house, because as you can see, it's it's quite impossible to keep up with. There's just too much
It's
going on.
difficult. Yeah,
Too
it's
much going
difficult.
on. Um,
So I mean, but yeah, I mean, any questions? Because we're running short on time.
yeah, I appreciate everybody's time. Please feel free to put your questions here in chat, and Jose and myself will do our best to answer. And as mentioned, next week sort of we're gonna take a step back from the Ascension stuff, but we're gonna be talking about topic of discussion is going to be more so how are big companies getting hacked easily, and should smaller practices be afraid? And we sort of, Jose, you said it earlier, as a business owner, not wanting to take that jump into that growth, is it worth it or not? So we'll
Well,
be
I
going.
mean, and again, there's other situations as well that we'll talk about next week.
Yes,
Do I want to be part of an ACO? Do I want to be part of an MSO? Do I want to be part of an organization that's a little bit more
structured.
structured, but structured in a different kind of way? It's like some of these private equities have set up, where you kind of run your own business. You're all under one umbrella, but you're all separate businesses. But for purposes of contracts and negotiations, you're one organization, one footprint.
Right, right,
So like there's different ways to set things up. It's just a matter of what fits your organization and where your organization is on the company lifeline. Are you at the beginning? Are you expanding? Are you retracting? Are you done? What's the goal?
we'll run a poll on that, Jose, next week. I think that would be a
Yeah,
good poll to ask, see where everybody's at.
yeah. Maybe we'll do that as the question, so that way we can kind of
Yeah,
lead
yeah,
into it.
I like that.
Cool.
But anybody got any questions, concerns? Let us know. Listen, we've been doing these webinars since October last year. We're always looking for topics to discuss, obviously in the healthcare compliance realm of things. But if you guys want us to talk about anything, let us know. If you're interested in coming on and talking, let us know. We would gladly interview you. And I know we're trying to bring one of our customers on that was affected by the Change Healthcare cybersecurity attack, and we're looking at interviewing her and her practices because they were. I mean,
Has she
they
said
were.
anything?
No, she's being shy, but I think I'm gonna. She's gonna do it. This is somebody that's taken our certified HIPAA security officer training. We've met them in person. She's just a little gun shy, but I think we're gonna be able to get her on eventually. But I want
Sounds
to get her
fun.
perspective on how their practice has been able to rise since that cyber attack, and obviously it affected their EHR. Patients were getting pissed off at them. I mean, it just was a nightmare. And then
Oh
obviously
yeah.
billing was delayed. Just a nightmare. And
Yeah.
um, I'd like to get her.
I mean, we are the bad guys.
Yeah,
Even though it's not our fault, we're the bad guys.
yeah.
Because the
It's not.
patient is affected, but we're the ones that are
You're taking the
patient
brunt.
facing.
You're the tier one. You're the
Yeah.
tier one getting.
Yeah, they don't care. I mean, I could tell you stories. They don't care if the pharmacy screws up. They don't care if the DME screws up. They don't care if imaging screws up because it's on us. Because why didn't we supervise them better? Why didn't we send it to a better pharmacy when they gave us the pharmacy they wanted us to send it to? I mean, it's special stuff, man. It's
Sadly
special
enough,
stuff.
it's above everything. They don't see
Yeah.
the bigger picture, unfortunately.
Nor
But
nor should
but
they
it's not
have
like
to.
that. Well, no, I agree. I agree. They
Nor should
shouldn't.
they
But
have to. I have to state that. It's not an
I would
ay
argue.
bendito, like, oh my God, poor me. We got
Right,
into
right.
this because we understood.
Yeah,
But
agree.
there are things that are above and beyond our control that are left on our plate that I wish were handled a little bit better
I
by
would
different
argue that
positions.
there should be more coverage on these sort of things these days, but it's
It's money. I mean, while
yeah,
we've got Biden and Trump in court, and then everything with Ukraine and Palestine and in Israel and Russia and all that
too many
ish.
too many things going on.
Yeah, yeah. it'll have to be a slow news day before something like
I
this
mean, I'm
hits.
sure it'll end up, but I know it's ended up on, like, for Jacksonville, for instance, it's been on some of the local news stations here.
Local markets, absolutely, but national ones, it's gonna have to have mass. I mean, look how
But you
big
would think
Change
to
was, and
change
that didn't hit.
healthcare. That's
Huh?
what I'm saying. It
Change
never
didn't
hit
hit
national
national
news.
news.
You think it would because it
You'd
affected
think.
2/3 of the, patient population. It's just,
You
yeah,
would think.
that's a big deal.
Yeah.
It makes me want to go back. What was going on in early February? What was national news
Remember,
talking about?
it
What
early
was the national
February
news?
was the will they or won't they with Israel jumping
Yeah,
into Palestine.
yeah, yeah, yeah. That's what it was. I don't know. That was a big deal. I think that should have made those levels of headlines, but yeah, to each their own. How many more of these will it take?
I
Because it
mean,
seems
you can
like
say that about a lot of different things, right? Like, I mean, there
yeah,
wasn't
sure.
any information on the bird flu that just killed the first human ever last week.
I didn't know about
Now, am
that.
I concerned about it? Not really, but I mean, it's nice to have known that.
I mean, I heard recently there's another COVID variant, but
Yeah, that's
how
the
many of
it's
those
the
have been?
bird flu. It's the
Is that
bird
what it is?
flu
Is that
that
what it's related
yeah,
to? Oh, okay.
yeah. Yeah,
Maybe
so
I didn't see something on that, but
but that's the point. So we'll see how it goes though.
yeah. Well, hey, Jose, appreciate your time and sorry for the internet outage, but we made it back, and
Yep. Just blame Comcast.
I'm gonna blame well, I'm blaming T-Mobile. Like I said, we can Comcast and went with T-Mobile. So, but I've had no issue. I mean, we've been doing this since October. I've had no issue since, but
Yeah,
it is what
yeah.
it is. It happens. But we
Yep.
did manage to get the recording. I'm gonna have to do a little bit of more editing now.
Well, let me
But
know if there's anything we need to re-record and we'll figure it out
yeah,
offline.
yeah, yeah, no worries. And for those that have joined, I appreciate you guys being here. I hope you guys found some value in this presentation. Obviously, we are going to follow up on this in the future once some of these class action lawsuits start coming out, and perhaps we find the real reason and the entry point of how this hack occurred. But until then, stay tuned. Like I said, we will be talking about uh, companies getting hacked, these big companies getting hacked easily, and how smaller businesses should react. Next week, Jose, you'll be on that as well.
Yep.
Everybody will receive a email with that registration link. So just stay tuned. If you guys have any questions here in the meantime, certainly feel free to reach out or to Jose or myself. Also, last but not least, if you haven't followed us on our social medias yet, please do. That's where you're going to get the latest updates on these events, specifically our YouTube channel. Like I said, we do post the full discussions on the YouTube channel. So if you know somebody that might be interested, you'll be able to go on there and send them those links. But like I said, if you haven't subscribed, please do. And like I said, appreciate everybody being here. We'll see you next week.
Well, guys.
Take care. Thanks, Jose. Bye.